Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 27th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 1,959, which is 40 new COVID cases since only Tuesday. I'm also very sad to report we've experienced an additional death this week, which brings the total number of COVID-19 deaths to 36 in Dubuque County. 8.3% of over the 23,500 people tested in Dubuque County have been positive overall since March. The 14-day average positivity rate is 7%. The number of positive cases in the 18 to 40 age group has creeped back up to 50%. As of yesterday, 9 Dubuque County individuals are currently hospitalized in Dubuque County, and 74% of Dubuque County positive cases have recovered to date. The state added 2,420 cases since Tuesday. So as of August 27, 2020 at 2 p.m., Iowa has a total of 59,702 positive cases. In all, about 1 in 5 Iowans, or over 616,000 people, have been tested. Almost 10% of Iowans tested have been positive. And yesterday's state 14-day average positivity rate was about 9%. Deaths reported in the state total 1,081 Iowans. Currently, 305 cases are hospitalized throughout the state. And finally, about 76% of Iowans have recovered. Governor Reynolds issued a new emergency proclamation today with additional measures to help limit the community spread of COVID-19 in Iowa. The proclamation strongly encourages all Iowans 2 years old or older to wear a mask or other face covering when in public settings, especially in circumstances when it's not possible to remain 6 feet away from others outside their household, unless it's unsafe, of course, to do so because of a health or disability. That, along with significant increases in the number of new COVID-19 cases among young adults, especially in the 19 to 24-year-old age group statewide, Reynolds also announced that effective 5 p.m. today, bars, taverns, breweries, and nightclubs will be closed in 6 Iowa counties. These counties include Blackhawk, Dallas, Johnson, Lynn, Polk, and Story, all until September 20th. In other news this week, you may have heard that the CDC modified its travel guidance. The modifications actually point to more self-responsibility in planning where you go, especially to places with high COVID-19 transmission occurring, and also being vigilant and mindful upon return from travel to watch for signs and symptoms of the virus and be careful not to associate with those vulnerable folks for 14 days after you return. I recommend visiting the CDC travel website for the most up-to-date information on where you may be traveling to, whether it's here in the U.S. or internationally. One more point to add on this. The news media reported this prior to the CDC updating their website guidance. Our Public Health Incident Management Team will not issue new guidance or recommendations based on media reports, but instead we wait for official notification from either the CDC or the Iowa Department of Public Health. That way we are assured we have accurate information to share and interpret. In other news, you may have heard the White House COVID-19 Task Force recommendation on testing, which stated, if you have been in close contact within 6 feet of a person with a COVID-19 infection for at least 15 minutes but do not have symptoms, you do not necessarily need a test unless you are a vulnerable individual or your healthcare provider or state or local public health official recommend you take one. That's a bit fuzzy or confusing recommendation, and neither the CDC nor the Iowa Department of Public Health has changed their testing guidelines on who should be tested. The Dubuque County Public Health Incident Management Team still recommends close contacts of positive COVID-19 individuals get tested, and our local Dubuque VNA will help set this up if a person has nowhere to get tested in a timely manner. However, with all of us, it's clear that among the White House Task Force, the CDC, and the Iowa Department of Public Health, they all agree that mass testing is not recommended or necessary for everyone, particularly for those that are not exposed or symptomatic. Some other statistics I usually don't mention really remind me of how significant this COVID-19 pandemic is. Dubuque County has 3.3% of the state's cases of COVID-19, and we are 3% of the state's population. We also have a rate of 1,982 cases per 100,000 population. This, along with the fact that we have 1,959 cases since March, and the state has over 59,000 cases, which, by the way, is way more than any other communicable disease I've dealt with over my 35-year public health career, is unprecedented. For those who think this pandemic is a hoax or insignificant or any other number of reasons to pass it off, keep in mind there hasn't been a disease or health issue that's impacted society around the entire world as much as COVID-19. At least not since maybe the 1918-19 influenza pandemic. Think of all the changes that have happened, many of which will be here to stay. Granted, some of these changes are improvements, and most will affect us for the rest of our lives. We're all part of history right now. Thanks for tuning in today. Today's change in bar operations in 6 Iowa counties, which coincidentally are where the larger universities are, should remind us of the importance of distancing ourselves from others as the best thing we can do to slow the spread and keep from getting infected with SARS-CoV-2 virus. Our businesses in Dubuque all need our support and want to stay open. So let's be respectful by following distancing and public health recommendations so we don't have more drastic closures. Have a great weekend, and whatever you decide to do, remember, we're all in this together.